Research by the Ghana Health Service has shown most women in urban areas are unwilling to use contraception. The study conducted between 2017 and 2018 revealed that only 23% of women in these urban communities use contraception or are willing to use them. The Ghana Health Service attributes this to misconceptions, especially about their side effects. Speaking at the launch of World Contraception Day and Family Planning Week in Accra, Director, Family Health Division of the Ghana Health Service, Dr. Patrick Aboagye, said this worrying trend makes it imperative to sensitize the public about the benefits of contraception. Evans Chinwe filed this report.
World Contraception Day is celebrated on September 26th every year. The day has been set aside to improve awareness of all contraceptive methods available and enable young people to make informed choices on their sexual and reproductive health. According to the Ghana Health Service, all individuals, including adolescents, are eligible to use contraceptives. Director, Family Health Division of the Ghana Health Service, Dr. Patrick Aboagye, says contraceptives have many benefits for women.
Over the years, become one of the leading countries in the sub-region, sub-Saharan Africa, when it comes to modern contraceptive use. Family planning underlines people's right to determine the number and spacing of their children by preventing unintended pregnancy. Family planning also prevents avoidable deaths of mothers and children. Similarly, family planning reduces the need for abortion, especially unsafe abortion. Dr. Yah have mentioned all that already. As such, family planning is a critical pillar in the demographic dividend framework, as it is a key strategy for reducing moving from high fertility, high maternal mortality, high child mortality to a situation of low fertility and consequently a reduced child and maternal mortality.
But a lot of women would want to stay away from contraceptives for various reasons, including side effects. Speaking on the theme, family planning, know the options, make your choices, Dr. Patrick Aboagye mentioned some of the challenges when it comes to the use of contraceptives.
Currently, we have about 7 of different types of modern family planning methods, both in the public and the private sector. And these are the implants. The good thing is I was going to explain what the implants are for those who don't know, but Dr. Yah has ably done that. The implants are the ones we inject subdermally in your skin. We also have the intrauterine devices. It used to be called the loop, and now became the IUD, because now it's a T, it's no more a loop. It used to be a tube, and it used to be loop, coil, and now it's a T. We also have the injectables, which we have several options, about 3 of such options available. We have the pill that we all know, the condoms, the natural family planning, which is also a modern method, which provides you with information that is and skills that allows you to be able to predict your fertility. And we also use cycle beads, which usually can be hung on your bed if the bed is where you are mostly close to having sex, so that you can see whether it is brown or it is dangerous, and so you can decide to hold on.
He, however, warned young girls to stop abusing emergency contraceptive pills, which have the tendency of causing infertility.
We don't want people to have emergency every day, and so we are promoting the regular methods. Unfortunately, there's been a lot of misuse, and sometimes people take more than they should be taking in a particular week or in a month. So we have begun an exercise that we are engaging the chemical shops and pharmacies to ensure that this kind of information is given.
Right, Dr. Paddy Ayate is with the Airport Women's Hospital, and he joins us via Skype with some education on the proper use of ECPs. Thank you very much, Dr. Ayate, for making time to speak with us. Now, what are ECPs and what are we not getting right about it?
Good evening. Emergency contraceptive pills are contraceptive methods that are required to be used in cases of emergencies.
Such as?
They are not intended to be used on a regular, everyday basis. The idea is that you are using a regular method, and the regular method has something goes wrong with the regular method. And for that reason, we need a backup. I use an example of it's like a car that has a foot brake that you use for your regular driving, and a hand brake that you can use in emergencies in case the foot brake fails.
All right.
So in case of a rape where there's unprotected sex, in case of a condom busting, examples of that sort. In case of the fact that you forgot to take your pill on the time that you should have taken it. Those are the reasons why we have the emergency contraceptive, is to use if your regular method fails you.
All right. So how are we abusing it?
Well, the intention is that in the event that your regular method has failed, you are required to take the dose. It's usually a single dose or maybe a 2-dose medication, depending on the type you have. And you take it preferably within 72 hours of the time of the unprotected sex. And after you've taken it that once, that's supposed to be the end, because you are not supposed to make that same mistake again that requires it.
All right.
Unfortunately, some people have decided that is their normal contraceptive method. You have sex on Monday, you take the pill. You have sex on Wednesday, you take another one. You have sex on Friday, you take another one. And it's not intended to be used that way.
What happens to you if you take it that way, or if you abuse it that way?
It will definitely have a significant effect on the way your menses comes. And your menstrual cycle is related to how you are able to how you get pregnant. So if you take it that way, your next that cycle and even your next cycle is most likely going to be affected. And we don't know how the effect goes on in subsequent cycles, even further down the line. But what we do know is that if we take it, it definitely affects the way. The drug's intention is to prevent ovulation or to prevent implantation, but essentially to prevent ovulation. And if you take it in that manner, it definitely affects your ovulation of this cycle. And depending on when you take it, it may affect the ovulation in the next cycle too as well.
All right. So what is the advice that you give to people who are using it or abusing it this way?
Get a normal, regular contraceptive method. Use that. In the event that you've noticed that has failed or something has gone wrong, you are permitted to use your emergency contraceptive as a backup to the other method. And if you do that once, whatever the mistake is, please correct it so that we don't require that you use it again in another few days' time. It's funny how people are afraid to use the regular pill because it contains hormones, but yes, use the emergency contraceptive 4 times a month, which also contain hormones. It doesn't quite make sense to me.
Yeah. All right. Thank you very much, Dr. Paddy Ayete, for bringing us that insight. And we do appreciate it. And so I believe the advice has gone out to everybody else that you don't abuse the emergency contraceptives. Now, beginning next term, 5-year-olds will be taught comprehensive sexuality education in Ghanaian public schools. Officials say the subject content would, however, be age appropriate. So the toddlers would be empowered with values that would protect them from sexual harassment. Some activists want the subject removed totally from the curriculum. Indeed, some parents Joy you spoke with are totally against the policy, saying it is too early at age 5 to expose the children to such a subject. Let's listen to some of the parents.
It's not necessary for the child to know about sex for now, because 5 years is he doesn't have any perception concerning sex.
A child at 5 years, you show as a sex in the media. You know, we have culture.
Yeah, but the fear is that because of technology now, children learn faster.
So if technology, that doesn't mean you have to show his sex technology. That one, I don't believe. It's not our culture. But our culture is different. We cannot take white man to compare with the blacks. Because we have our real culture. Me, my hometown like this, me have a Basari man, we will not do like that. Before you, as a woman, you know a man there, you have to mature before you know. So me there, I know I give them.
That one will not help, because at the age of 5 years, and you are going to teach that child sex education, it won't help. It's very bad. At least from 10, 11 years, they can start teaching them from sex education. And one thing I've realized is single parenting. They are having single room. Maybe the boyfriend will be coming to her or him, and this thing will be going on whilst the child is not asleep. The child is keeping that thing. So the moment he goes to a class and see a friend, what the dad and the mom did, he also will be doing it. But we teaching them from 5 years, I don't think it's the best. The best is from at least from 10 years upwards.
This is a good thing. The reason being that if we don't create the awareness early to put them in their right tools, when they go out definitely into the internet, they'll learn what will probably not be the best for them. There is a saying that catch them young, you understand? So when we teach them in the earliest stage, I believe by the time they'll get to the stage that they'll probably indulge in that, it will help them.
Age of 5 on sexual relationships, no, I don't think it's good. At least from 12 years going, it will be best for the children.
Why 12?
Because 12, you know, they are getting to adolescent age. You see what I mean? So if you educate them from 12 going, you know, it's good than 5 years. You know, from 5 years you see the boys and the girls doing some nasty things which are not good for the parents.
Right, MFA Power has been studying the guidelines for comprehensive sexual education in Ghana issued by the Ghana Education Service, and she joins me in studio. Thank you very much, MFA. So let's break it down. Most of the parents are concerned that if you're exposing them to sexuality education that at that age, you're essentially telling them or teaching them to be naughty.
It's okay to be naughty. Okay, so what we've been told is that that's not necessarily the case, because...
So what are the children going to be taught?
Okay, so as it stands now, we're told that what we're seeing in this document that I have is already being implemented in the schools.
Oh, it's already
and that's what's raising a lot of concerns for many parents already, because they're telling us that what we see in this guideline, the comprehensive sexuality education, is not new. That's what NACA is saying, that this is not new at all. It's already in the curriculum that is being implemented, and a number of teachers have also stated that that is what is happening as we speak.
Are they already teaching them at age 5?
That's what they're telling us. But guess what, Easy? Some of the things that we're seeing in here, if indeed they're already teaching our children, most parents say they're unaware. I'm a parent. I'm not aware that my child, for instance, at primary 5, who is 10 years, is being taught about relationships, friendship, dating, and courtship. And that's in here.
Primary 5?
Yes, that's 10 years,
10 years
at primary 5.
Okay.
They're teaching them about friendship, dating, and courtship, as well as puberty changes as we grow. That's okay. They're teaching them about population of Ghana, religion, and social values. We are told this whole guideline is put together by the Ghana Health Service, the Ghana Education Service, of course, in partnership with the UNFPA.
Right.
And that's it. For primary 4, no, for P4, which is age 4 to 5 years, which is the bone of contention for many, which is the preschool level. They will be taught what we believe in and how we interact. They will be taught personal hygiene and oral hygiene. So this is where most people are afraid that the introduction of alien culture will be done at this point. Because what we believe in, what do you believe in? Like homosexuality, like some have said. So what if the teacher, even though it is not accepted nationwide, is against the law to be a homosexual, for instance, but what if the teacher believes in that it's okay for you to be a homosexual? What we have interns from outside coming in to teach our children, then they teach them what they believe in. What does it entail? How do we interact? That is not here in this guideline. But they've told us that what we see in the guideline is not the curriculum itself, but this is what the modules tell us, that this is a guide for the teachers in terms of what they're going to teach our children. So it goes all the way to JHS 3, then to SHS level. So for JHS 2, for instance, 13 years, they'll be taught about alcohol, drug, and substance abuse. They also be talked about respecting gender differences, dealing with gender discrimination, then gender and power relations. They also talk about communication, negotiation skills, and then assertive skills as well, which is all right. And then also at the JHS 1 level, they will be taught about fertility regulation, abstinence, contraceptives, and other methods.
I think at that age, yes, it's quite okay. But I'm more concerned about
exactly at the 7 years, 8 years, 9 years. What's the business in teaching them about abortion? What's the business in teaching them about dating and courtship? That's what parents can grapple with. What exactly is, the objective of this? For 11 years, for instance, you are teaching them about fertility, pregnancy-related issues, and childbirth.
Okay, 11. Yeah, you may say they're that old.
Most parents will not agree with you, Israel. Most parents will not agree with you, but for 11 years, you're teaching them about abortion and unintended pregnancy and all. That's for 12 years as well.
They're probably warning them that you shouldn't be getting an abortion at that age,
and
or avoid the things that would lead you to the point where you have to get an abortion.
But that's why we are not getting the education as to what exactly does this curriculum entail. What are you telling them about abortion? I need to know. That's what parents are asking, that they need to know exactly what you are telling them at that age when it comes to abortion, where you're telling them about unintended pregnancy. So you're telling them that if you get pregnant at that age, you have the option of aborting it. Is that what it is? That's where
there's some facts that have been going out, which we would want to share with you. It still has to do with sexuality education. And so here we have sexuality education in Ghana, new evidence from 3 regions. And it says, this fact sheet is that the need for comprehensive sexual and reproductive health education. It says comprehensive sexual and reproductive health education is necessary to ensure healthy sexual and reproductive lives for adolescents. It should include accurate information on a range of age-appropriate topics, should be participatory, and should foster knowledge, attitudes, values, and practical skills to enable adolescents to develop positive views of their sexuality. There's a bit more there on that on that website, which you can go to much
interestingly,
later on. And then the UNFPA also it says still on its responsibility to ensure that comprehensive sexuality education is a great tool for empowering the adolescent girl, has appealed to the Ghanaian media to be a strong advocate in this area. They were speaking at the event held at the National Press Center in Accra on 10th December 2018, and where they talked about the discourse with the media is for them to understand clearly the concept and importance of CSE for the Ghanaian girl child. But MFO, before you go, speaking on Joy FM Super Morning Show, Advocacy Officer of PPAG, Akajigeri Binori Joshua, said the subject of sexuality education is essential for the growth of young people.
Where in this country do we talk about these things? And where do we find a lot of young people? They are in school. And if you don't want to introduce comprehensive sexuality education to expose young people to this scientifically accurate information, culturally responsive, because we are looking at the cultural context, and it should respond to the needs of the people within the context. And it's age appropriate. You can't go and be talking to a 10-year-old girl about abortion. When you look at the curriculum, we have a manual. If you look at the curriculum, the age to start talking about comprehensive sexuality education is at age 5. And at that age, you talk about values, personal hygiene. Don't you think a 5-year-old should know about values? Personal values, family values, community values. Don't you think they should know? Don't you think they should know personal hygiene? Don't you think they should know that if someone touches this part, it's private? Don't let anyone touch. If someone touches, you tell your mom, you tell your teacher, you tell your dad. Don't you think people should know about these things?
All right, now MF is still with me in the studio, and the main concern that a lot of people have, apart from the fact that they feel that at age 5, it's too early for the children to be introduced to sexuality education. It has to do with homosexuality and the fact that this may be a means for the authorities to expose the children to homosexuality. What has been said so far about that? We know that in this document, it doesn't say, there's nothing to that effect.
But earlier, when we got hold of this document, Joy News, the Ghana Education Service, the NACA, amongst others, were unable to own up to this document, even though PPAG had stated that they were going to implement it. So it was one of the concerns that we put to NACA, for instance. They are in charge of the implementation and developing of our curriculums in the country. Dr. Prince Amatlis, I just spoke to him on Newsnight before I came in. He said that they are assuring all parents that that is not going to happen. They are ensuring that the curriculum that they've put together, even though they are already implementing, they are ensuring that there is no way that any alien culture like homosexuality, amongst others, will be brought into the system.
All right. Thank you very much, MFA Pao. And MFA Pao has been educating us on sex in the last 10 minutes. Still to come in the bulletin, the police are on a manhunt for 3 more people believed to have been involved in the murder of 2 traffic police officers at Kasobuduguam last month. The 6 others held in connection with the crime were freed on Thursday. The Vice President has announced procurement directive to ensure state agencies buy only locally manufactured toilet paper.
The import bill for toilet rolls last year was $70 million. That was the import bill for toilet rolls. And we are importing from countries as far as Vietnam, Honduras, Panama.
That's a lot of millions of dollars spent on toilet paper. Stay tuned in. Business news also comes up. A medical officer at the Kolbu Teaching Hospital says he's alarmed at the increasing rate of lifestyle diseases being reported. Citing hypertension as an example, Dr. Alex Lago believes certain lifestyles are a contributory factor. He is calling for a change in these attitudes. Dr. Lago made this call at a health screening program organized by the TF Financial Services here in Accra. Here's a report by Philip Ankra.
Lifestyle diseases are associated with the way a person or group of people live, and they include heart diseases, stroke, obesity, type 2 diabetes, and diseases associated with smoking, alcohol, and drug abuse. Dr. Alex Lago, a medical officer at the Kolbu Teaching Hospital, says these lifestyle choices can be deadly.
We've come to a point in the world where, especially in developing countries, where there is a double disease burden. And with that, we are talking about both communicable diseases and then the non-communicable diseases. And these ones are mainly the lifestyle diseases. Sad part of it is that these conditions, they tend to be chronic. Okay, and there are risk factors that are associated with it. There are some of the risk factors that are modifiable, where we can, in a way, change it. But others too, they are not modifiable, like we are born with it and we can't really do anything about it. So the advice is actually to advise to get people who have these modifiable risk factors, for them to change their way of life, to change their lifestyle. And with that, we will be able to reduce the burden, actually.
Head of Human Resource at TF Financial Services, Edith Blankson, called on Ghanaians to care more about their health.
Traditionally, the environment we find ourselves, we are not used to the regular checkups that people do in a different environment. People walk, and there's the saying that the living dead. And there are a lot of things that goes on in our bodies that people physically think they are healthy. Then suddenly something happens and then we say, oh, I just saw him yesterday. So we think that, no, their health status.
Explaining the rationale behind the health screening, Customer Service Coordinator at TF Financial Services, Maonyo Nuchi, said the company is not only interested in doing business with its clients, but in their well-being as well.
We are not just interested in making profit out of our clients, but we are also, should I say, concerned about their health. So we are concerned about their well-being and all that. So as clients, as a customer to our external customers as well, I guess we need to put things together to meet their needs as well.
Their program was part of activities to commemorate the company's week-long Customer Appreciation Week. Philip Ankra for Joy News.
The Christian Health Association of Ghana has expressed worry over the country's inability to measure the quality of healthcare delivery. According to the Executive Director, Peter Yeboah, though accessibility has been increased within the sector, the issues about quality care needs to be improved. It is for this reason that CHAG, in collaboration with Farm Access, is set to begin a quality improvement program that rates all the over 300 health facilities under it. Nancy Mefedradozi was at the event and our report.
There has been several media reports on misdiagnosis, poor healthcare delivery service, lack of much-needed care, which has led to maternal and neonatal deaths in both urban and suburban locations over the years. The World Health Organization estimates that in Ghana, 1 out of 10 hospitalized patients will develop an infection. The situation has led to deaths, drawing the quality of healthcare backwards.
CHAG facilities were associated with high quality standard. And now things have changed because we couldn't keep to that standard. And we are now struggling and in serious competition with others who were nowhere near us in the past.
The Executive Director of the Christian Health Association of Ghana, Peter Yeboah, believes the quality of healthcare in the country has to be standardized to ensure that citizens will receive the same quality of care in every hospital, wherever they are.
We have not achieved our vision of quality, affordable healthcare for everybody, which is a thrust of our march towards achieving universal health coverage. Indeed, colleagues, instead of health for all, we have achieved health for some. And even those that we have provided health for some, the safety and guarantee in terms of quality cannot be validated by anyone.
It is for this reason that CHAG, in collaboration with pharmacists, is rolling out a quality assessment system that measures how well each health institution performs compared to others in the country. Maxwell Akwesientri is country director of pharmacists.
We want to rate or provide a star for every facility or every hospital within the network. And the stars range from 1 to 5. 1 means that it is not too good. 5 means that it is the best you can get throughout the world, international best practice. So we will first rate all of them. And it will spread between 1 to 5. Secondly, we will help those who are below 5 to work to improve, to work towards getting to 5. And thirdly, we will be building the capacity of the doctors and nurses and midwives and pharmacists and technicians within the network so that after the 3 years, they can still continue in the quality improvement program.
The Deputy Minister of Health, Alexander Kojokom-Aban, told Joy News his ministry will monitor progress of the new system and will incorporate it in the Ghana Health Service.
Whereas we would want to learn from all best practices. So now that they are trying this safe care, okay, where they are going to have a platform to assess the quality of service given by various health facilities within CHAG, we would also follow it closely. And if we see that it is something that we have to roll out to the whole country, why not? We will do that.
Meanwhile, the final assessment of the Quality Improvement Program will be announced after 3 years.
Vice President Dr. Mahamudu Bawumia has directed all government institutions to, as a matter of policy, purchase only locally manufactured toilet roll from the next procurement cycle. With 14 companies actively producing toilet roll in the country, Dr. Bawumia says there is no justification in importing the item because Ghana has the capacity to meet the demands of a majority of its people. The directive was given Thursday afternoon at the Nsawam medium security prisons in the Eastern region when the Vice President inspected operations of Brompton Group, a toilet roll manufacturing company there. Latif Idris has more.
The visit by the Vice President was to follow up on the operations of the Paper Products Company. The factory, which was launched in May this year by President Coup, manufactures toilet paper, tissues, paper towels and packaging products. Brampton Portfolio is doing this in collaboration with the Ghana Prison Service in Project Efiase as an additional source of income to the service, whilst improving conditions of the prison and providing employable skills and income to inmates. The Vice President is hopeful the procurement directive should cut down the country's high toilet roll import bill.
1D, 1F has brought 5, we had an existing 9. So we have 14, and the capacity of that 14 is able to meet most of our demand for toilet rolls in Ghana. So why import? So we are saying that from the next procurement cycle, all government institutions, whether it's the military or the police or the hospitals or the schools or, all government institutions, because the taxpayer funds all government institutions. If you're going to buy toilet roll, all that toilet roll must be bought from locally manufacturing companies. Locally produced toilet roll.
Managing Director of the company, James Top-Yanka, says they are currently producing not less than 26,000 pieces of toilet roll daily, but can even do more with the right support and intervention by government.
The announcement has been very critical, and we are very grateful to the government that they are supporting us. And we believe that this is a government that's actually listening to us, because most of the people that we're all youthful, and this is our contribution to the economy. And we believe that this step is going to help us get the relevant patronage to help this business become very viable. We are also creating employment on all the district levels, because we are supplying our products in all the districts in Ghana as well.
Government is set to roll out 4 new models under the Youth Employment Agency. The new models, according to the Deputy Information Minister Pius Hajide, is to provide more sustainable jobs for the teeming unemployed youth in the country. The NPP, in the lead-up to the 2016 election, ran a campaign on the theme Agenda for Change, Jobs, Prosperity and Securing the Peace. Government has introduced some programs, including the much-touted Nation Builders Corps, to deal with the unemployment situation. Now, at a news briefing Thursday, Deputy Information Minister Pius Hajide announced new models under the YEA will be launched next week by the Vice President in a bid to provide sustainable jobs.
The agency has introduced 4 key initiatives to create sustainable employment. These are: 1, the Job Center. It is a platform to link job seekers to employers. 2, Artisan Directory, a center that will train and set up artisans, beauticians, masons, tilers, carpenters, fashion designers, etc., and make them accessible through the use of ICT. That's the Artisan Directory. 3, agric-based flagship programs. This is a development initiative or initiatives in various regions and districts, taking into cognizance the natural resource endowments and comparative advantages of those regions and districts. These may include maize farms, fish farms, smoke villages, cassava plantation, etc. 4, work abroad program to enable the export of young professionals into other countries, such as nurses, teachers, etc., etc.
The YEA, Akwesi Friye, says the work abroad model will not be limited to nurses and teachers.
The nurses and teachers are examples of what we are going to do. It's not limited to a particular kind of profession. What we are doing is to collaborate with our embassies across the world. So our diplomats across the world are doing a needs assessment and are furnishing us with requests or the needs of those countries. So, for example, you have Cote d'Ivoire, which has a lot of its people coming into Ghana to study English. And we have a lot of young graduates who have come out of school and are well-versed in English. We are asking, can we not send them into Cote d'Ivoire to teach English and expatriate?
Well, Deputy Information Minister Pius Ajide says the export of labor under the work abroad model will be done in a manner that will not affect the country's human resource base.
Yes, it is a deliberate YEA policy. It will be launched by His Excellency the Vice President. The YEA is mandated by law to promulgate and formulate these policies. And by extension, yes, it is a policy of the government to do this. I'm also briefed that in doing the selection, our own peculiarities are also taken into cognizance. There are areas that we also need and desire workers, critical masses of workers in this country, and some of them we do not even have inadequate supply at the moment. In those areas, critical attention will be paid to so that the typical brain drain scenario does not come to haunt us in the long term. But I think that this concept from the YEA is innovative and creative. If you particularly compared it to modules in previous administration and regimes, modules such as youth in bicycle repairs and so on and so forth, I think that this is a worthy innovation.
The country's security agency is investigating the alleged coup plot against the presidency, saying they have identified more individuals who government says are persons of interest in the conspiracy. Police prosecutors have already slapped 3 men, including the alleged mastermind, Dr. Yao Makpam, with 5 charges, including conspiracy to manufacture ammunition without lawful authority and possession of firearms without lawful excuse. An unspecified number of military men, also said to be collaborators, are being interrogated. Deputy Information Minister Pius Ajide at a news conference on Thursday provided further details about the investigations.
We want to discourage strongly attempts by sections of our population, especially on social media and even sometimes in traditional media by acclaimed, self-acclaimed security and intelligence experts to attempt to ridicule what information the government has put out. This is a result of sustained surveillance. We all know, history reminds us, that the assassination of the former president of the United States of America, John F. Kennedy, took a bullet. Just one person with a gun was arrested. Again, the assassination attempt on former President Ronald Reagan, it took one person with one gun who fired one bullet to attempt to assassinate President Ronald Reagan. And so I think that the security agencies, after having convinced themselves that there was clear and present danger, especially after the firepower that was manufactured was successfully tested, the security experts came to the conclusion that there was a clear and present danger and went ahead to arrest these persons. I think that the attempt from some quarters to ridicule this is rather unfortunate and should not be encouraged. Well, I take your suggestion, but like you said, you are not the expert, neither am I the expert. The experts who are doing the investigations, I'm sure, know exactly what they are doing. They have identified persons of interest. Some of them might as well be staff of the Citadel Hospital, and those persons of interest are being interrogated and investigations are ongoing.
He's also been shedding some light on the sophistication and threat posed by the suspected coup plotters prior to their arrest.
It is indeed true that the X-ray container at the Citadel Hospital belonging to Dr. Makpam had been turned into a weapons manufacturing facility. Several improvised explosive devices were manufactured there. It is true that chemicals were purchased from the Kolebu Teaching Hospital for the manufacture of these devices. It is true that Mr. Makpam made contact with a gentleman who works at the base workshop at the Burma camp, offered him money to supply 10 AK-47 rifles. It is true that there is a plan which indicates strategic installations and facilities that were to be targeted at the H hour. And it is also true that there was a test firing of the weapons that were produced at these makeshift, if you may, arms manufacturing facility that we describe.
State prosecutors say the police are on a manhunt for 3 persons accused of assisting one Eric Kojodia to kill 2 policemen. 6 others initially charged before an Accra District Court in relation to the crime have also been freed. The deceased policemen were personnel of the Motor Transport and Traffic Department at Kaswa. Court correspondent Joseph Akable reports a charge of murder was however maintained for the main suspect, Eric Kojodia.
ASP Sylvester Sari informed the court fresh developments have left the state with no choice but to drop the case against 6 persons. They are Isaac Emisa, Ibrahim Zakaria, Isaac Mensah, Oblete Komi, Victor Yere, and Fatau Ahmed. Key suspect Eric Kojodia, however, remains before the court on charges of conspiracy to murder and murder relating to the death of Sergeant Michael Jamesi and Lance Corporal Awar Mohammed. 3 others identified as Mike Enin, Theophilus, and K, according to police sources, are at large. Documents filed in court indicate that the 3 at all material times were with Kojodia in the vehicle when they were accosted by the police. They are also said to have sped off with him and later abandoned the vehicle at Kokrobite. Documents filed in court states that Eric Kojodia admitted during interrogation that he shot the policeman. Hearing of the case continues on October 9.
The Secondary Police Command has arrested 2 persons for possessing a human skull. Police sources say the suspects are believed to have exhumed the skull from the Nzema area and was bailed to meet prospective buyer in Secondary, but luck eluded them and the arrest. The situation attracted many who thronged the police station to catch a glimpse of the suspects. This development comes in the wake of the abduction of people in the Secondary Takoradi metropolis in recent times, including the 4 missing Takoradi girls. Natalia Kwanson sent in this report.
The 2 young men, Isaac Kweku Ejapon, 20 years old, and Shamsusu Muhammad, 18 years old, were arrested at Asamansudu, a suburb of Secondary in the Western region, Thursday afternoon. The 2 had approached a resident, John, not his real name, to inquire of where human parts are sold. The revelation, according to John, got him alarmed, considering recent occurrences in the metropolis.
They asked me where human parts are sold, and I was alarmed. I went to call my brother, but they ran away. We later saw them at the gate, took them to police station, but the police seemed too busy to talk to us.
Our source says the suspects, Isaac and Shamsusu, are residents of Ankobra in the Elembele district and Abuaze in the Shama district, respectively. They reportedly exhumed the skull from a grave at Asanda, a farming community in the Elembele district. Secondary Divisional Commander Chief Superintendent Foley Washington has further explanations on what led to the arrest of the 2 suspects.
In actual fact, our attention was drawn to a mob action in the street around Contraception this afternoon. I mean, early or late afternoon, late morning, that is around 10:45. So my men were dispatched to the field to assist what is going on. In actual fact, they brought 2 young men at the age of 18 to the police station. So what we have to do first is to interrogate them to find out where and how did they come by all these items. In actual fact, they informed us that they were three. They went to Asanda Cemetery near Lembele to collect the skull for sale in Assemsido area. Unfortunately, when they were at the roadside, the youth in the community accosted them and about to lynch them when the police came to their aid.
In Nathalia Kwanzaa's report for Joy News.
Okay, that's it for the bulletin. I'm Israel Lai. You have a good night.